Hey everyone, it's Missy David from honeybeemama.com and welcome to the birth experience. My goal is to show you that you don't have to be afraid of childbirth, and I do that by using simple and effective training techniques and by getting you the tools and resources that you need to be empowered and make informed decisions about your birth experience. Today I want to expand a little bit more and talk specifically about the 6 ways to progress in labor. The 6 ways to progress in labor are important to understand because these 6 things pretty much need to happen for you to birth your baby. And understanding why it's happening and what's happening in your body will help you know whether or not you're on the right track. Number 1 is cervical softness. You know what your cervix is. Your cervix is the lower part of your uterus where your baby is going to come out eventually. Well, before labor starts, the cervix, it looks similar to a bottleneck. So your uterus is wide, and then towards the bottom, your cervix is narrow, and it's long and thick and hard. The best way to look at it is to feel your forehead. Before labor, your cervix is very firm, like the way that your forehead feels if you gently press on it. And as things progress, it slowly gets a little bit softer, like the tip of your nose. And at the end, either, when you're going into labor or as you are progressed in labor, it will eventually be as soft as the skin on your chin. Number 2 is cervical position. So your cervix before labor is pointing towards your back. We call this a posterior position. During labor, your cervix has to come forward and line up with the birth canal so that you can birth your baby through your vagina. If your cervix is opening and dilating, but it's still pointed towards your back, you can't push your baby out. So it has to come forward to an anterior position so that you can give birth to your baby. Number 3, cervical effacement. We talked about cervical softness. Your cervix needs to soften and get pliable. Effacement is actually the shortening of the cervix. So we talked about how before labor, your cervix is long and thick like a bottleneck. Effacement means your cervix is shortening so that it can eventually open up and allow your baby to come through. Effacement is measured in both centimeters and percentage. For example, before labor, your cervix is about 1.5 inches thick. By the time you push your baby out, there will be, your doctor or nurse might say, there's no cervix left. It's totally thin. So 50% effaced might be about 2 centimeters, and 100% effaced would be paper thin or nothing. Number 4, cervical dilation. This is measured in centimeters and refers to how open the cervix is. Most of us are familiar with hearing about cervical dilation. We know that before labor, your cervix is 0 centimeters dilated, and you've got to get all the way to a 10 before you can push your baby out. In the 3 stages of labor, the first stage of labor is the stage of cervical dilation. In very early labor, you're 0 to about 4 centimeters dilated. Active labor is 4 centimeters to about 8 centimeters dilated. Transition is 8 to 10 centimeters dilated. And then once you're 10 centimeters dilated, you're considered complete and it's time to start pushing. The 5th way that we progress during labor has to do with the baby's rotation of their head and the molding of their skull. So a way to think about it is sort of the baby working with the mother in labor and kind of shimmying and moving his little head and figuring out the way to position himself to get through the birth canal. Usually babies rotate. If they are sunny side up and posterior, they will rotate their heads so that they are considered what we call occiput anterior, or with the back of their skull facing forward, because it's an easier way to get through the birth canal. Sometimes not. Babies can be posterior and still be born. It just kind of makes it a little bit harder on the mom. So cross your fingers for an OA baby. It definitely makes it a little bit easier. But if you have an OP baby, it's not impossible. Number 6, the 6th way to progress in labor, refers to the baby's station. Station refers to where the baby's head is in relation to the ischial spines in the pelvis. So if this is the mid-pelvis, -3 station would be above. 0 station is in line with your mid-pelvis, and +3 is going to be when the baby is crowning and pushing. So why is it important to understand the 6 ways to progress in labor? There's 2 reasons. Number 1, it can be really discouraging if the only thing that your care provider is telling you is your dilation. So, for example, for several hours, you might think that you are stuck at a 5 and you're not progressing at all. Well, during those several hours, maybe at the beginning, your baby was at a -2 station, and at the end of those 3 hours, maybe you're still dilated to a 5, but your baby as a 0 station. So you know your baby's station has progressed. That can be really encouraging to not feel like, oh my gosh, nothing's happening. I'm never gonna have this baby. You know that other things are progressing even if dilation is not progressing. The same thing with effacement. Early on in labor, when you're first admitted to the hospital, they might say, oh, you're 60% effaced and you're a 1. A few hours later, if they say, oh, you're still a 1, you might feel really discouraged and think I'm not really progressing, but you might be 100% effaced and your cervix is much softer and your baby has moved down a little bit, or your cervix has come forward a little bit. So it's really important to ask about some of the other ways that you're progressing if your care provider is only telling you about dilation, and that can really help you assess the rest of your progression and be really encouraging instead of making you feel like nothing's happening. The second reason that it's important is similar to why we wanted to understand the process of normal birth in the What is Normal Birth video. It helps you make informed decisions. So if there is a complication, say everything is moving along, everything is progressing except for one of the ways of progression. So for example, you're completely effaced, you're completely dilated, but baby is still really high in the pelvis at a -3. This could indicate a problem. It may just need more time for baby to move down in the pelvis, or there could be a reason why the baby's not moving down in the pelvis. Maybe the baby is too large to be birthed vaginally. Maybe baby is in a poor position and can't turn around and can't rotate to come down and through the birth canal. Or maybe you're dilating, baby is moving down, you're effacing, but your cervix isn't coming forward. Well, your cervix can be dilated to a 10, but if it's facing towards your back and not lining up with the birth canal, you can't push a baby out that way. So that could be a complication that you may need some interventions to help you with. Like we talked about on the normal birth video, you might need a medical intervention to help get you back on track. It may not necessarily mean a C-section, but it may mean some either natural interventions or some medical interventions. So remember, this is your birth and your baby. No one gets to do anything to you or your baby that you don't give them permission to do. Just make sure that you're making your decisions based on good evidence and not based on fear. Be empowered and informed and have your best birth experience. Thanks for watching. Be sure to like this video. Make sure and subscribe to Honeybee Mama. Leave me a comment on my blog or on Facebook or on this video, and I'll see you next time on The Birth Experience.